Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to learn how to move with spondylolisthesis, whether it's in your neck or your lower back, without pain. We're going to break down the motions into bending forward and backward, side to side, and twisting, which so many of us have a problem with our spondylolisthesis because it aggravates pain and limits our daily activities. Today's video is going to help you learn how to move, get back into fitness without hurting yourself. Hope you enjoy it. So remember, there's 3 points that we have to keep in mind if we're going to learn to move with spondylolisthesis without hurting ourselves. Number one, we want to hold a neutral spine. That means holding our spinal segment that slipped forward in the case of spondylolisthesis in a safe zone or neutral position. 2, to use the supporting musculature that helps to hold it in place correctly. And 3, to move through a limited pain-free range of motion by limiting the actual motion in the site that has the spondylolisthesis and emphasizing motion in different areas. Now, when we talk about point number one, holding a neutral spine, both in the neck and the back, there are going to be motions, front and back in particular, that are going to aggravate spondylolisthesis. You need to learn where that motion is and how to hold yourself in the middle of that motion. So in other words, if I have pain in my neck with a spondylolisthesis going forwards and backwards, I want to go back as far as I can before I feel the pain. Same thing in the lower back. Mark that position in my mind as one limitation, and then go forward until I maybe feel a little tug or a little pull. That would be the other limitation. I want to position my spine halfway, midpoint between those two extremes. The same thing can be done with lateral flexion or side bending, where I find pain at a certain point, I feel a little tugging at another point. I want to position myself in a neutral position, as well as rotation. Once we determine that neutral position, we want to use our muscles uniquely that our bodies have problems with in a way to support that. Now, the reason I say uniquely that we have problems with is because each of us has unique mechanical issues, postural issues, and so many of us have muscle imbalances from right to left, front to back sides of our spine. If you haven't yet done so, go to either the Pain Free and Fit or the Posture Size website, take our free body analysis, learn what your unique mechanical issues are and stability issues are, so you can use these muscles to hold your spine in a good neutral position. Without knowing, for instance, that you have a weak multifidus muscle, that you have an overactive internal oblique, that you have a tendency to protract or elevate a shoulder on one side, or to slightly tilt or forward translate your head, you're not going to be able to ever stabilize that spine to the point where it's going to really avoid itself being irritated with movement. So once we have number 1 and 2 in, meaning we've found a neutral position to hold our spine in, and number 2, where we're recruiting the correct muscles to hold it there, then we're going to practice moving. Number 1, for twisting, we want to start from the hips. If we twist to one side using our hips rather than our lower back, we're going to keep our belly button and pubic bone aligned. If my belly button went further than my pubic bone moved, that's going to create a stress or a rotation in my lower back, very often irritating my spondylolisthesis. So I go as far as I can with my hips, I make sure my pubic bone doesn't move further, and I finish the motion by turning my shoulders. You see that? Now I'm rotating from my upper back. My low back still hasn't rotated. It's in a safe zone. It's helping to hold that neutral spine position that keeps it safe without irritating my lower back spondylolisthesis. And my neck, I only want to turn as far as comfortable without going to a range that's going to irritate my spondylum. I want to emphasize keeping my face tucked towards the back of my head, because often as I turn, I'm going to goose my head forward, and that many times will aggravate a spondylolisthesis. So that's a way that you can start practicing moving without irritating yourself and twisting motions. Most spondylolisthesis is actually aggravated by extension or leaning backwards, which pinches posterior disc fibers, facet joints, causes synovitis, chronic shortening of muscles. So the way we're going to tackle leaning backwards without aggravating ourselves is we're going to hold a posterior pelvic tilt. We're going to keep the tailbone tucked under to a comfortable degree, or pubic bone up. That's going to open up the arch in our back so it's not as compressed. We're going to use abdominal tension, hunching down to make sure that that position stays so. And we're going to lean back from our hip joints, where our pelvis is going to roll around the top of the thigh. You see that? Now that is not making any motion happen in my lower back. I can put my hand there and check it. I'm keeping my tail under, my abs tight like I'm crunching down, and I'm letting my whole pelvis, my iliac bones, rotate backwards around the hip joint. And that's how I'm going to lean back from my lower back, or my hip region really, without aggravating low back spondylolisthesis. For my neck, I want to keep that face back or head retraction motion, and I want to tilt from my mid-back in between my shoulder blades. Now my neck is not extending, which pinches the back of that spondylolisthesis, but I'm extending backwards from more my mid-back as I emphasize chin tucked under my jaw and face back into itself. I can combine these two so I have a full body, tail under crunch, head back, full body extension, mid-back. Look at how far I can go. I'm not bending from my lower back or my neck, and I'm looking up at about 30 degrees here. You don't need more than that for most overhead activities. Whether you're reaching up to do something like painting your room, changing a light bulb, or working out in the gym, leaning backwards, you're going to have a safe way to hold your body without aggravating your spondylol. Side leaning, we want to use the legs and the hips to bend sideways. Many times if we're just leaning sideways for something, whether it be at the lower back spondylol getting pinched on one side or overstretched on another, or in our neck being pinched to one side, we're going to aggravate our spondylolisthesis. If we, however, bend our knee and our hip and allow our entire body from the hips to move to one side and allow our mid-back again to bend, I can now get about 30 degrees of sideways bending, even more if I bend one knee at a time, keeping my ribs and pelvis equally distanced apart by bending the knee and lowering the whole hip, and bending from my mid-back with my face tucked back into itself. That avoids that forward head translation. These techniques can be used both bending forwards and backwards, twisting, and sideways to help aggravating your spondylolisthesis. Hey, if you like what we're talking about here, give me a thumbs up below, help me share it with others. If you have any questions or comments about spondylolisthesis or other conditions related to your training, give me a comment, your questions below. I'll do my best to get back to you. I love hearing your comments and questions. It gives me fuel to use for my next topic. If you have a topic that we haven't yet covered, I'd be delighted to cover it for you. Subscribe to our channel to learn more of these great techniques and use these tips to help with your spondylolisthesis.